Hello everyone. Hope you're all having a good day so far. Welcome to episode 6 of my second season. Today is Wednesday, February 10th, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, did you ask what's going on with G2211? Well, look no more. I get into it in this episode. This episode highlights the OIG Work Plan for January 2021. I also deliver my trusty tip on the goings-on for new HCPCS code G2211, and I share inspirational words from Simon Sinek. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and 5-star rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and Nexsen Pruet podcast series do not constitute legal advice, but I am fortunate to work with sound healthcare attorneys at Nexsen Pruet, and as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. So, let's get into Newsworthy. I wanted to go over the 12 new January 2021 updates made to the OIG Work Plan. The first update is titled Audit of HHS Sole Source Contracts Awarded for COVID-19 Testing. Now, HHS established contracts under the Public Health and Social Services Emergency Fund to prevent, prepare for, and respond to the COVID-19 pandemic. The contracts cover more than 600 COVID-19 testing sites in 48 states, as well as the District of Columbia. The contracts utilize a federal bundled payment program paid directly to retailers that receive a flat fee for each test administered, with participating retailers responsible for coordinating the full end-to-end testing. The Federal Acquisition Regulation, the FAR, guides the acquisition process by which executive agencies of the federal government acquire goods and services by contract with appropriated funds. The Health and Human Services Acquisition Regulation establishes uniform HHS acquisition policies and procedures that implement and supplement the FAR. The contracts that HHS awarded to contractors were sole source contracts totaling approximately $1 billion for COVID-19 testing. The OIG will review the awarding and management of contracts for COVID-19 testing to determine compliance with applicable federal statutes, regulations, HHS policies and procedures, contract terms and conditions, as well as the allowability of claimed costs. The final report is expected in fiscal year 2021. Now, the second update to the January 2021 OIG Work Plan is titled Hospital Experiences Responding to the COVID-19 Pandemic, February 2021 Pulse Surveys. This study will serve as a follow-up to the OIG's April 2020 report titled Hospital Experiences Responding to the COVID-19 Pandemic, Results of a National Pulse Survey from March 23rd through March 27th of 2020. Now, that particular study was a survey of hospitals about their experiences in responding to COVID-19 approximately 1 year after the prior report. Now, the OIG will contact the same randomly selected hospitals and conduct pulse surveys to identify their current challenges in responding to COVID-19, anticipated challenges in returning to standard operations post-pandemic, and how the government can best support hospitals. The review will provide timely information about hospital operations during the pandemic to HHS administrators and other key decision makers. The final report is expected in fiscal year 2021. Now, the third update to the January 2021 OIG Work Plan is titled Health Resources and Services Administration's Monitoring of High-Risk COVID-19 Grantees. The Health Resources and Services Administration, also known as HRSA, is the primary federal agency for improving healthcare to people who are geographically isolated and economically or medically vulnerable. HRSA funds nearly 1,400 health centers that deliver care to the most vulnerable individuals and families, regardless of their ability to pay. HRSA should identify and mitigate risks related to awarding grants to health centers in order to minimize the potential misuse or loss of federal funds as required by the HHS Grants Policy Administration Manual in Part F, Chapter 4A.1. Now, in the spring of 2020, HRSA awarded through 3 programs nearly $2 billion to approximately 1,380 health centers in response to the COVID-19 pandemic. To expedite distribution of this funding, HRSA did not require that health centers apply for grants. Instead, it made funds immediately available to those health centers. Those health centers had 30 days from the award release date to submit the information that is usually submitted, reviewed, and approved during the grant application process prior to a grantee receiving funding. The information that each of the health centers provided included a program narrative, a budget and a budget narrative, as well as a list of equipment to be purchased if applicable. The OIG will determine whether HRSA had an effective process for identifying and monitoring high-risk health centers that received COVID-19 grant funds. This final report is expected in fiscal year 2022. Now, the fourth update to the January 2021 OIG Work Plan is titled Medicare Needs Better Controls to Prevent Fraud, Waste, and Abuse Related to Orthotic Braces. Prior OIG work identified inappropriate payments for orthotic braces that were not medically necessary, not documented in accordance with Medicare requirements, or otherwise fraudulent. The OIG will compile the results of prior OIG audits, evaluations, and investigations of orthotic braces that were paid for by Medicare. They will also analyze data to identify trends in payment, compliance, and fraud vulnerabilities, and offer their recommendations for improving detected vulnerabilities. The final report is expected in fiscal year 2021. Now, the fifth update to the January 2021 OIG Work Plan is titled Medicare Part D Payments During Covered Part A SNF Stays. Now, Medicare Part A prospective payments to skilled nursing facilities, the SNFs, cover most services, including drugs and biologicals furnished by the SNF for use in the facility for the care and treatment of beneficiaries. Accordingly, Medicare Part D drug plans should then and therefore not pay for prescription drugs related to post-hospital SNF care because these drugs are already included in the consolidated payment for Part A SNF stays. The OIG will determine whether Medicare Part D paid for drugs that should have been paid under Part A SNF stays. The final report is expected in fiscal year 2022. Now, the sixth update to the January 2021 OIG Work Plan is titled Background Checks for Nursing Home Employees. Federal Regulation 42 CFR 483.12 A3 provides beneficiaries who rely on long-term care services with protection from abuse, neglect, and theft by preventing prospective employees with disqualifying offenses from being employed by these care providers and facilities. The National Background Check Program was enacted by legislation in the year 2010 to assist states in developing and improving systems for conducting federal and state background checks. Prior OIG work has shown that not all states complied with the National Background Check Program for long-term care providers. The OIG will determine whether Medicaid beneficiaries in nursing homes in selected states were adequately safeguarded from caregivers with a criminal history of abuse, neglect, exploitation, mistreatment of residents, or misappropriation of resident property, according to federal requirements. The final report is expected in fiscal year 2022. Now, the seventh update to the January 2021 OIG Work Plan is titled Audit of Delinquent Non-Custodial Parents, Tax Refund and Economic Impact Payment Intercepts. The Child Support Enforcement Program is a federal, state, and local partnership established in 1975 under Title 4D of the Social Security Act to collect child support payments from non-custodial parents for distribution to custodial parents. Now, the CARES Act, or the Coronavirus Aid, Relief, and Economic Securities Act, signed into law on March 27, 2020, provides qualifying individuals with a recovery rebate, also known as an economic impact payment, of up to $1,200 or $2,400 if married and filing jointly, plus up to $500 for each qualifying child. Congress added a number of exemptions concerning the economic impact payments within the CARES Act. However, it did not exempt child support debt. According to estimates, up to 10.5 million non-custodial parents, are delinquent in their payment of child support and could have their economic impact payments intercepted. Based on the significant impact that the CARES Act will have on the collection of delinquent child support due to the intercept of economic impact payments, the OIG determined that the focus of their audit would be to determine whether selected states have policies and procedures in place to ensure the state child support programs collected and distributed delinquent child support under the federal tax refund offset program. The failure to have effective procedures in place to ensure the collection and distribution of delinquent child support can result in essential child support funds not being provided to custodial parents during the COVID-19 pandemic. The final report is expected in fiscal year 2022. Now, the eighth update to the January 2021 OIG Work Plan is titled Audit of Home Health Services Provided as Telehealth During the COVID-19 Public Health Emergency, the PHE. Now, on March 13, 2020, remember, a national emergency was declared in response to the COVID-19 pandemic, which allowed CMS to take proactive steps to support the response to COVID-19 through the use of Section 1135 waivers. By means of this authority, CMS waived certain requirements in order to expand Medicare telehealth benefits to healthcare professionals who were previously ineligible, including physical therapists, occupational therapists, speech-language pathologists, and others. CMS also amended regulations to allow home health agencies to use telecommunications systems in conjunction with in-person visits. The amended regulations state that number 1, the use of technology must be related to the skilled services being furnished, and number 2, the use of technology must be included in the plan of care with the description of how the technology will help to achieve goals without substituting for an in-person visit. The OIG will evaluate home health services provided by agencies during the COVID-19 public health emergency to determine which types of skilled services were furnished via telehealth and whether those services were administered and billed in accordance with Medicare requirements. They will report as overpayments any services that were improperly billed. And they will make appropriate recommendations to CMS based on the results of their review. The final report is expected in fiscal year 2022. Now, the 9th update to the January 2021 OIG Work Plan is titled Duplicate Payments Made by Medicare and the Department of Veterans Affairs, the Veterans Community Care Program. Now, the Veterans Community Care Program, the VCCP, authorizes the Department of Veterans Affairs, the VA, to furnish hospital care and medical services to eligible veterans through agreements with non-VA providers. Duplicate claims may be improperly paid by both Medicare and the VCCP if claims for services are billed into both programs. Because Medicare regulations prohibit payment for services that are paid for either directly or indirectly by another government entity, like the VA, they are subject to a few exceptions. Medicare is not responsible for payment of claims for services in which the VCCP has already paid for those services. The payments associated with these claims are considered overpayments. This audit is a collaborative effort with the VA OIG to determine whether the VCCP and Medicare paid duplicate claims for the same medical services. The final report is expected in fiscal year 2022. Now, the 10th update to the January 2021 OIG Work Plan is titled Medicaid Claims for Federal Reimbursement Using Managed Care Proxy Methodology. Federal health care benefits are generally allowable when provided to a beneficiary who is a U.S. citizen, a U.S. national, or a qualified alien. Generally, a qualified alien is ineligible for full-scope Medicaid services before 5 years have passed from the date he or she enters the U.S. with qualifying status, which is a 5-year bar. Medicaid eligibility for most qualified aliens who are subject to the 5-year bar is generally limited to emergency services, restricted scope services. Now, states may choose to provide full scope services to qualified aliens who are subject to the 5-year bar using their own state funds. Furthermore, states may choose to cover full scope services to aliens permanently residing in the U.S. under color of law and to children under the age of 19, regardless of immigration status. However, the costs related to non-emergency services provided to non-citizens in these groups without satisfactory immigration status are not eligible for federal reimbursement. The OIG will review whether states properly claimed federal Medicaid reimbursement related to services provided to non-citizens who lacked satisfactory immigration status. The final report is expected in fiscal year 2022. Now, the 11th update to the January 2021 OIG Work Plan is titled Audits of Medicare Part B Telehealth Services During the COVID-19 Public Health Emergency, the PHE. Now, telehealth is playing an important role during the PHE, and CMS is exploring how telehealth services can be expanded beyond the PHE to provide care for Medicare beneficiaries. Because of telehealth's changing role, the OIG will conduct a series of audits in Medicare Part B telehealth services in 2 phases. Now, the first phase, or Phase 1 audits, will focus on making an early assessment of whether services such as evaluation and management, opioid use order, end-stage renal disease, and psychotherapy meet Medicare requirements. and that particular Phase 1 audit has its own work plan number. Now, in Phase 2 audits will include additional audits of Medicare Part B telehealth services related to distant and originating site locations, virtual check-in services, electronic visits, remote patient monitoring, use of telehealth technology, and annual wellness visits to determine whether Medicare requirements are met. This work plan update is for the Phase 2 audit, and again, it has its own work plan number. The final reports are expected in fiscal year 2021. Now, the 12th and final OIG work plan update for January 2021 is titled Home Health Agencies, Challenges and Strategies in Responding to the COVID-19 Pandemic. Home health agencies, or HHAs, have faced unprecedented challenges to providing care during the COVID-19 pandemic. Reported challenges include, but are not limited to, procuring necessary equipment and supplies, implementing telehealth to treat patients remotely, and addressing staffing shortages. However, the full spectrum of these challenges, including how challenges have evolved over time, is unknown. HHAs have used some strategies to address these challenges, but the array of strategies and the extent to which HHAs found them helpful are also unknown. This nationwide study will provide insights into the strategies HHAs have used to address the challenges presented by the COVID-19 pandemic, including how well their emergency preparedness plans served them during the COVID-19 pandemic. The final report is expected in fiscal year 2022. Now, in my opinion, I always believe providers and practices need this critical information to review their coding and billing practices or overarching compliance programs. As you can see, 3 out of the 12 work plan items will address the accuracy of telehealth reimbursement during the PHE. As I predicted, with almost 3 months of early twists and turns and tweaks that happened on an almost daily basis in the spring of 2020. Yet, it is still unclear of the amounts that will be in controversy or how we can successfully navigate the potential overpayments that will be issued. Nonetheless, we're now cognizant of all of the facts that more audit letters are sure to come. And let's not forget that little mention of orthotic braces in this work plan update, as I've already discussed in a couple of prior episodes with my compliance tips and recommendations. The OIG stands ready to help CMS in developing better controls to prevent fraud, waste, and abuse in these lucrative supplies. I think these reports with findings are always most interesting and informative, and I always look forward to analyzing them in the years ahead. It's also important for my listeners to keep an eye on these monthly OIG work plan updates to see how they may impact you, your provider, or your health system. Remember, even in my second season, stay tuned for my monthly OIG work plan updates. They drop the second Wednesday of each month. And now, it's time for my best practice tips in Trusty Tip. Let's dive into the new HCPCS code for 2021 in G2211. By definition, G2211 is for visit complexity inherent to evaluation and management associated with medical care services that serve as the continuing focal point for all needed healthcare services and or with medical care services that are part of ongoing care related to a patient's single, serious condition or a complex condition. It's an add-on code listed separately in addition to office or outpatient evaluation and management visit, new or established. Now, however, Medicare administrative contractors are now denying separate payment for HCPCS code G2211 based on the January 2021 Outpatient Prospective Payment System, the OPS, pricer file. And because under Section 113 of the Consolidated Appropriations Act, HHS is not paying for this code under the physician fee schedule until January 1st of 2024. So be mindful that for now, HCPCS code G2211 is considered a bundled service. Medicare administrative contractors will apparently automatically reprocess claims that were paid, and providers and practices don't need to do anything, except ensure if you are using it to keep an eye out. It will be an unnecessary headache to return any and all accidental payments between now and December 31st of 2023. The subtext here is also that G2211 was actually being paid for a few weeks now, by which max I do not know, but it's very deflating to see those recoupments that may be happening as I speak. Remember, a better, smarter approach is one that is proactive and starts by painting a clear, rich, and colorful medical picture the first time, so your certified medical coders can then abstract codes, or not, with accuracy. And finally, in this week's inspiring quote in Spark is from the British-born American author and motivational speaker, Simon Sinek. Achievement happens when we pursue and attain what we want. Success comes when we are in clear pursuit of why we want it. 100% accurate, right? I think this is a tremendous statement on elements that make up greatness, achievement, and success. And I couldn't agree more. We can start by looking within to identify our larger goals and aim to achieve them one by one. We have our lives ahead of us to pursue and commit to our why. I am happy Simon Sinek's spark shines on in all of us today. So that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Aim a little higher, do a little more, and give back in any way you can in 2021. There's so much each one of us can do. As always, I appreciate you diving into today with me. And if you would like to inquire about my consultant services, you can always reach me through my email address at nexsenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy, practice safety for one and all during our collective life in the time of coronavirus. Thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday. If you want more information from me, go ahead and follow me on LinkedIn or send me an email at sonalpatel@nexsenpruet.com for all my consulting services in medical coding, auditing, and compliance. Thank you.